let's talk back pain. If you're watching this, you're either having pain or you've had pain, or better yet, you want to prevent pain. And maybe you fit the 30 to 60 age category where back pain is very prevalent. Make sure you stay to the end of the video where I share 3 of my favorite drills to help prevent back pain from happening in the first place. So low back pain is the most common thing that we treat in the clinic, and it's the most common location for back pain. Now, in terms of a conservative approach, we are looking for back pain that is mechanical in nature, meaning that it is due to or responds to some kind of loading, movement, durational component. It's not just constant back pain no matter what you do, no matter what you try, it's still there, no better, no worse. In that case, definitely get evaluated and see what's going on. It could be something a little bit more serious, or you're just in a very irritated, acute state of back pain. So that being said, this is just general information. This is not specific medical advice. Everyone is different and everyone's presentation may vary. So definitely get evaluated by your local trusted physical therapist that can help develop a plan specific to you. So as you see here, there's a lot going on in the spine, different vertebrae, discs, nerves, ligaments, joints. Different things can be the source of pain. However, does it really matter the source? Well, some people say yes, some people say no. I try not to focus too much on the direct source, or at least we don't have to label it per se, okay? We want to see how you're responding, what your symptoms are, how they respond to treatment, and so forth to help to determine what's going on. If nothing makes sense, getting imaging, x-rays, MRIs help to kind of paint the overall picture, but honestly, it's usually not necessary right away when it comes to conservative physical therapy. Another quick note on imaging, it's not something that we solely rely on to treat a patient. I've had patients that come in presenting relatively minimal symptoms, minimal pain, and they still want to get an MRI, so they go ahead and they get an MRI, and guess what? That MRI shows a massive disc bulge or herniation. Go figure. And I've had the opposite, where patients are coming in with a ton of pain, a ton of symptoms. They get imaging and it's negative for anything. So again, it doesn't always give us the full picture, but yes, it does help to confirm or deny certain things if the rest of the picture makes sense, right? So in this video, I'm going to cover 3 general concepts that we cover, that I cover in treating back pain for the most part. Again, very generalized. So let's jump into these 3 concepts and see what it's all about. All right, concept 1 is range of motion and overall mobility, starting at the spine and then looking down to the hips, because they're very close in relation and location, and they're always connected in one way or another. Ultimately, I'm looking at forward bending, backwards bending, side bending, and rotation movement, as well as a key component that I'll share later on as well. So, are any of those movements limited? Are they painful? That gives a lot of information. In many cases, people are missing extension because we live in such a forwardly flexed lifestyle and environment. Usually that over time, we lose our ability to extend and bend backwards. And sometimes that can be an issue. So if that's a finding that I find, that's going to be one of the first things that we try to address, and restoring, full lumbar extension. Okay. One way of doing it, and there are lots of tweaks in between to make it very individual to the person's needs and restrictions. So the second component is hip mobility, and I look at hip rotation and extension as the primary limitations that I see, but we're also checking flexion, abduction, adduction, external rotation, all of the above. We want to get a good idea of overall movement through the pelvic region. And then the third concept is core strength and motor control, and how well can someone recruit all the layers of our core and not just the six-pack in front. Okay, so here's a secret in terms of another concept to evaluate when looking at low back pain. And that secret is the side glide. So you're going to use a doorway and you're going to evaluate if there's a difference in this side gliding movement of the lumbar spine. And if there is, you're going to want to treat that. Okay, so before I get into my 3 favorite exercises to help prevent and manage back pain, we're just going to summarize this video as a whole. When approaching back pain and managing back pain, my 3 concepts are regaining range of motion through the spine, regaining range of motion through the hips, and core strengthening and motor control training. Some form, some sequence, some variation of all those 3 things have to happen in order to properly manage and prevent back pain, in my opinion. And if that doesn't work, then we have to look at other options and potentially refer out to other medical professionals to further manage the pain. However, that doesn't mean that people need to stop physical therapy, because I think it always goes along with any other treatment, whether it be conservative or more invasive. So let's jump into my 3 favorite exercises to help prevent back pain and manage it overall. Jump into 3 exercises to help prevent back pain without the need of any equipment at all. You just maybe need some household items that can increase a little loading to add resistance if needed. So the first one is a quadruped hover. Okay, from here we can go into some movement, but starting off with just a hold similar to a plank. Okay, so again, a nice tabletop position. My hands are right under my shoulders, my knees are right under my hips. Maintaining a 90-degree angle here is very important in making this a challenging exercise. From here, I'm just coming up off my knees and I'm going to hold. I'm going to brace. I'm going to make sure that I maintain that back position. And I'm going to hold for time, just like a plank. And if you do it right, you should feel a nice shake. You get benefits of shoulder stability as well, and not just core stability. You're really working all the way hands to your toes and activating in a nice isometric. From there, we're going to take a backpack and fill it with books or whatever you got to make it nice and heavy. And we're going to just work on some unilateral trunk loading and maintaining a nice upright position, so I'm not letting this bag take me down and I'm not overcorrecting. Okay, so we're going to hold it out to the side, and then if you want to include some dynamic component, you're going to walk forward, you're going to walk backwards, you can walk sideways, but ultimately you're sustaining that upright trunk posture. Third and final exercise for this video, my all-time favorite drill is a bent over row of some kind. In this case, I will be using 2 kettlebells, but again, you can use 2 backpacks, 1 backpack, challenge the stability however you want it. The reason why I love this drill so much is that it practices trunk stability in a forwardly bent position, because like I said before, that is how we live our lives. So we need to be able to stabilize and control that position at as high a capacity as needed for our daily demands. If we're lifting kids, if we're lifting whatever, it's always going to be kind of out in front of us. So if we don't train that way, we can't get stronger to do that task better. So let's jump into it. So there's definitely some key concepts in movement positions and patterns you have to understand well to perform in this. So if you're struggling, make sure to grasp those concepts first. Hip hinges, neutral spine, and being able to move and maintain those pieces is key to be able to do this well. If you can't do it well, definitely don't load it. Practice the movement unloaded first. All right, so I have 20 pounds on each end. Okay, I'm gonna hinge forward. From here, I'm gonna let my arms hang, and I'm just pulling, just doing a gentle row while bracing, keeping my hips level, resisting any rotation. Okay, from the side, it's gonna look like this. Hinge forward, nice neutral back position. Doing this on one leg for that added pelvic and trunk stability demands. Okay, if you can perfect that and load it appropriately, it's gonna go a long way in injury prevention, not only just your back pain. Okay? same thing can be done with the backpack. You do one side. Okay, doesn't matter how you load it, as long as you load it. All right, guys, so that's a wrap for this video. Hopefully you enjoyed it and found it helpful. If you do, please subscribe to the channel, give it a thumbs up, and I'll catch you guys next time.